Thank you, Dr. Abdi, and thank you for reading the title because it's super long and that would have taken like two of my 5 minutes. So I'm going to jump right in, except that. Oh, there we go. So this is an excellent study. I think I saw Dr. Friedman, who's one of the authors here in the audience, so if he has any comments, I appreciate that. Basically, it looked at a novel generation large spot pulse dye laser versus the prior generation pulse dye laser. And one of the key points is that the novel pulse dye laser has a larger maximum spot size of 15 millimeters. It was a retrospective review of patients receiving treatment, again, with either the novel pulse dye laser or the previous version pulse dye laser, both 595 nanometer systems, and it looked at high volume clinical sites from 2011 to 2021. Inclusion criteria, patients of all ages, skin type, and port wine birthmark location, and they took photographs and analyzed them independently. There were 160 patients which were included with skin types 1 through 4, 80 patients who had undergone the novel pulse dye laser and 80 patients who had undergone the previous version. Mean age at first treatment was 21 years. Probably important to know this, although they did have all ages, it wasn't primarily a pediatric population, et cetera. There was some slight differences in terms of the cohort for the previous version versus novel one in terms of location. But most importantly, note here on the bottom that the previous version, they had a mean maximum spot size of 10.8 millimeters with mean maximum energy of 8.8 joules per centimeter squared and the pulse duration 0.45 to 6 milliseconds, whereas with the novel pulse dye laser, they had a mean maximum spot size of 13.1 millimeters, mean maximum energy of 7.3, and pulse durations from 0.45 to 3 milliseconds. So quickly summarizing that, lower energy with larger spot sizes with the novel device. Now, when you looked at the results, overall there was no significant differences in mean improvement after treatment between the two. However, there were statistically significant differences, especially when you looked at the V1 and V2 locations on the face. There was also, although less significant, a statistically significant difference for V3. Going on and analyzing the results further, they did find that the mean number of treatments to achieve equal to or greater than 50% improvement was 8.8 with the previous version and 4.3 with the novel version. So again, fewer, significantly fewer. And the multiple regression analysis showed that age or location did not seem to make a significant difference. Here's just a couple quick pictures. We all know the pulse dye laser can do an amazing job, and this is, of course, another example. So, use of the novel large spot pulse dye laser achieved equal to or greater than 50% improvement in the port wine birthmarks with fewer treatments. The novel pulse dye laser with larger spot size and lower fluence, this allowed treatment time to be reduced and also potentially this discomfort reduced because you could use lower energies. Really quickly, increasing the spot size can increase the energy reaching the blood vessel target with less risk of epidermal injury. Larger spot sizes also allow better depth penetration for better energy delivery to deeper structures and may allow fewer treatments, minimizing the use of general anesthesia for pediatric patients where it's important. This difference may mostly be due to the radiant energy difference. So if you can calculate the radiant energy by using fluence times spot size. And so for the novel device, it was 9.7 compared with the previous device where it was 8 joules. This Fabian Masali, who I don't think is here this morning, but medical student, helped me to get this. I think it just, with the picture, kind of shows you why this might be a difference. One comment I just wanted to make is sometimes I like to use a small spot size like a 7 millimeter when I'm doing like the eyelid of a child or something like that. So there are some advantages sometimes to a small spot size, but overall. And then obviously there's always limitations of study, small number per body area, retrospective studies so you couldn't control for everything, but overall a really nice study. Novel pulse dye laser larger spot showed fewer treatments to achieve at least 50% improvement compared with the previous version. Larger spot sizes may have great utility to improve port wine birthmark treatment. Thank you.